Welcome back to the show. We read in the papers today that the Edo State governor has come up with a policy to encourage COVID-19 vaccinations, and the expectation is that it will now become compulsory for everyone in the state to carry an indication that they've been vaccinated before they can attend public events like your church, like your mosque, schools, the offices. It will be compulsory within Edo State for everyone to get vaccinated. This is their own way of ensuring that they reduce mortality within their state due to COVID-19. Now, some people are now saying that, okay, we know you want to protect us, but we're not interested. We should have freedom of right to choose whether we want to live or we want to die. And some are saying that the government is pushing it too far, that even other countries that have recorded high number of deaths haven't made it compulsory for every citizen to get vaccinated. So the question is, what are your thoughts on this? Do you believe this is a welcome development to encourage to make vaccination compulsory? Or would you agree that people should be given freedom to decide whether they want to get vaccinated or not? You can call us on 081-270-53687, or you can call us on 091-390-76948. We'd like to hear from you on what you think. Now, Nima, this is your state. So very soon. And you have decided not to vaccinate.
I didn't decide.
Not
that she will. I was studying the options that I had. I've had COVID, so I know better. Yes, and I'm already, my immunity is quite strong, yes.
But still, according to your state governor now, in a very short time, if you want to go to your state, you need to show proof that you have been vaccinated.
I want to see my grandma now.
Exactly.
The only loving relative I have left in Edo State, yes. So I think it's a welcome thing.
Really?
Yes, but I doubt, I think it's also bogus or ambitious. I find some loopholes will be existing there. Edo State is a place that is not as developed as Lagos, and I wonder how enforcing it would happen. And I fear for abuses of you, because they require you to now carry a vaccine card around. So I fear abuses. I also fear people, fraud happening, people doctoring the cards. I wonder how it will be. I think if they have proper data, vaccines are movable. For places like Edo, my grandma, for instance, will not go to any hospital except we go home to take her, or my cousins take her for that. And it's a long journey from Ibe to Benin. And even if they're doing it within the polytechnic that is closest to us, it's still a long journey for someone that is 90. So I think it's something that the governor should have a large plan on how to implement. If they had what they call this, like the polio vaccine, people carry the vaccines, find a cooling van to carry it into the villages, go to the palace, because it's very local like that. Go to the palace, compel, elicit the use of the town criers for some of these villages interior.
Town criers?
And yes.
2021?
Yes, they do. Yes, even in Lagos, in Ikorodu, in some of those areas, yes. And I love to see those kind of things. Go into those interiors, use whatever language that they speak and to talk to them about it, educate them, and get them to the king's palace. They speak in their dialect to them and tell them the benefits of it and give it to them. I think that will work largely than start to enforce and put a standing order down, because this will only work within Benin and the University of Benin and within the civil service. The way it is now, but it's welcome.
They intend to implement from the second week of September that large gatherings will not be allowed except you are vaccinated. You will not be allowed to attend parties except you are vaccinated.
How about schools for your children? I guess
they said worship centers will not be. No, they didn't mention schools. I'm waiting to see if they didn't mention schools. Just public gatherings will not be allowed if you don't have your vaccination card. I was also hoping that there will be an extensive report on how far they have gone in vaccination on ground. So if you have data that we vaccinated about 20% and we have the capacity to vaccinate 80%, then I can understand why you would say no more physical gathering, except you're saying that until everybody's vaccinated, let's go back to lockdown. Maybe this is another way of implementing, backroom of implementing lockdown.
I would say that I think our governments are always in a hurry to just reel out these policies. So they just, okay, how do we get these people to comply? And the first thing that comes into their head is usually force. But you need to understand the sort of people that you have, the sort of people that you are leading. Let me not use the word rule, but we know how it is. The sort of people that you are leading, you need to come down to their level so that everybody is carried along. So what are some of the measures that you have put in place to carry them along? Like you mentioned, going to the villages. What are some of the sensitizations that you have done? How have you promoted jingles? How have you gone to the marketplaces to speak to them so that they even understand? A lot of people still, till today, have issues with taking the vaccines. They still have the conspiracy theories. They're still asking if the, what's this?
Is magnetic.
The magnet, if it's magnetic till today. That means that we have not done enough to educate them on the benefits of vaccinating them. So if you now come up with, okay, if you're not vaccinated, you'll not be able to do this, how do you even plan to enforce it? Because the truth is, it will definitely be abused. You could say, after you have put all the measures in place, that, okay, for you to, especially for people in the cities, because the fear is always people in the cities are the ones that have access to traveling and all that. But in those rural areas, are you still going to use the same policy for people in the rural areas? Let's try and understand some of this.
Okay, so I like where you went about what the amount of vaccines available.
Exactly.
We know that Nigeria is waiting on COVAX or wherever to send us vaccines before we can then, you know, start vaccinating people. So I'm hoping that this is based off on information maybe that says that they have received their quota to give for Edo State, but they just have so much more left in the cooler because people are not coming to get vaccinated. And so the government, based on that information, is trying to ensure that more people are vaccinated. So, and in doing that, I don't see anything wrong with that. The reason I don't see anything wrong with asking that people must be vaccinated. So it's not that you must all be vaccinated. It's that, well, if you need to go to church, be vaccinated. So that, yes, if you want to go to the party, be vaccinated. So if I want to be vaccinated, I go and get my vaccine. Simple. So it's not really a, if you are not vaccinated, then we'll lock you up in prison,
like
whatever.
saying that, you know, me, I'm vaccinated, so I can go to parties. I've already been vaccinated.
Okay, So when you do that, because one thing with vaccination is that when those unvaccinated are more than those vaccinated, the effect of it is, yes, you don't get that immunity, that herd immunity. So for a lot of other vaccines that people do not want to be, that a lot of people have sort of taken themselves out of, especially with children's vaccines, is that in that situation, we have more children vaccinated, more people have the vaccine, so you enjoy that herd community. But this is what we're trying to build in Nigeria, in Edo State. So even if the numbers of those not vaccinated is higher than those vaccinated, it's like zero. So we need to up the numbers. And it's a good thing for Edo State because it means that your governor is in tune with what is important for your health. And so it's important also, apart from asking that people, you know, compulsorily be vaccinated, like you said, we need to educate people better. We need for them to understand that the needs are just needs and they're not, you know, correct. But also that Nigerians also need to seek important information, because I notice, you know, sometimes when we're talking about these important things, Nigerians like to tune off because it's not about bass pepper them, you know, but when it has to do with your health, it has to do with vaccine, ask the questions, let the people be there to answer the questions, let those in charge of giving these vaccines be educated enough to give people informed answers when they do ask.
Let me take Ikena from Oka. Good morning.
Yes, good morning.
Good morning, Ikena. Welcome to the show. You're live.
Thank you very much.
Yeah.
It is not about getting vaccinated. The question is, this whole thing, what is it all about? As a country, as a nation, we have our medical doctors, we have our experts, you know, that into this. Nigeria has come with level.
Oh, I think we lost that call. Iken, are you still there? Okay. Let's go on a break. Let's go on a break. When we come back, we'll take more phone calls. So let's hear from you. What do you think about Edo State making this move to make vaccination compulsory? Do you agree or do you disagree? Call us after this break. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we'll be discussing the new law that is about to be, the new order that is about to be implemented in Edo State that will not allow anybody to have access to public space, have events, churches, religious gatherings, generally, if you are not vaccinated. Vaccination will be compulsory, and you must hold your vaccination card for you to have access to public space. People are saying, is it right or is it wrong? And we've all discussed it from different perspectives, but I think seemingly we all feel like there is need for vaccination.
We agree.
But we don't want to compel vaccination without pushing information. So the goal should not be, let's just say, everybody, you must compulsorily do this. But we realize that Nigerians might not obey unless they are compelled. So maybe he's giving his people in a way they understand. Because if he puts the restriction, maybe it would move more people towards getting their vaccines. What are people saying on social media?
So Temi Adeleke on Facebook says, Nigeria and Nigerians, I beg, get vaccinated. COVID death is painful and harrowing. Margaret Oguntola said, good morning, sisters. Please, have we got enough vaccine to go around before enforcing? Lola Lawal Adeumi says, no government should have the right or power to force anybody to take vaccines whose long-term effect is not yet known. This is wrong on all fronts. How many vaccines have ever been forced on people? Why is this one being forced? I should have a right over my body. What of those who get side effects? Will the government take responsibility for side effects for people who have not had the COVID since all the noise?
Very important question. Let me quickly take Olanrewaju from Agege. Olanrewaju, welcome to the show. Good morning. Good morning, Olanrewaju. Can you hear me?
Hello, good morning.
Good morning. You're live.
You guys, you are well done, my sisters. You are doing a wonderful job. Do you know what? I only want to appeal Nigeria, not to see our leaders' information and laws as a burden to us. Let us see it as a needful thing we need. Because if you want to see it as a law, nobody will follow it. Because those who are making the law, they are the ones violating it. It's very, very clear to all of us. We have seen what happened maybe 2 or 3 days back now. Let the campaign commence now. You can see how people... It's also, don't let us... But we in Nigeria, let us say, okay, this is a death sentence. Let us cover ourselves. Let's protect ourselves. But I personally am telling you, if I have to follow the government directive, I will not even follow it. Because themselves, they are less concerned about the law they make.
Olanrewaju is addressing the hypocrisy of the government because, you know, Edo State had elections this year and the campaigns, we saw how it went during the pandemic, that it wasn't like there was a lot of compliance with the challenge. So, but he's advising still that we should get vaccinated for ourselves. Nima,
I think this is...
Some people for religious, some people for religious reasons do not want to get vaccinated. But it shouldn't, and how does this contravene their individual human rights to say, I don't want to get vaccinated?
There's of course a clash of people's rights to do things freely, to choose what they want. This is something that will be applied on the person. And I think without legal backing, the governor cannot just say, you must take it to carry a card. Yes. How many vaccines do we even have? Wait. In Edo State, how many vaccines were they given? What's the population of Edo State? How practical exactly? Are you just trying to restrict people's movement by using an excuse, or you truly, truly want them vaccinated? For people to get vaccinated, I support. But to compel and restrict their movement to carry a card, I see too many abuses. And, you know, this is what I expect to be well done, something that, you know, will be well thought through, holistically put together. People have the right to choose to take it or not. Yes, and you can say, okay, if you don't have access card, there are certain places you can't come. But when it clashes with their right to enter that place or use that place, there will be issues.
The developed countries are not still doing that now.
There's nowhere in the world where it's I understand people's rights, but if your right to not take the vaccine would affect my child, your own child coming to affect my own child in the same school as just because people have refused to take the vaccine. Please, I'm not going to take that either.
There are non-invasive procedures. Wait, hold on a minute, Miriam. There are non-invasive procedures already given as guidelines.
Like wearing of those masks.
Compel people to wear face masks. How have you enforced that already? Compel people to sanitize. How many hand-washing centers have you provided
in
Edo State? There are many farming communities within Edo State. How many have you done? So that when we are talking, and let us not just be like we're just, you know.
Let me take Maria, and I'll come to you, Mariam.
Hello.
Hello, good morning, Maria.
Good morning, Maria. Ladies in the house.
Good morning, Ma.
Very well, thank you.
It's nice listening to your program this morning. You see, we live in a country where everybody feels they can do things anyhow. And it's so sad. Even the non-pharmacological procedures that were given to us, are we complying? No. We are not complying. When people say, oh, COVID, Kosikoro, I just laugh at them and shake my head. And the unfortunate thing again is that people, Maria, my sister is there now. She said she's been infected before. So that's why she's still studying it. I have had colleagues, I'm a doctor. I've had colleagues who have been infected twice. I've even had colleagues recently now who died. So understand, people are working to save lives. Those who refuse, and these doctors I'm talking about, they've either had one shot, some have not had a second shot. Our immunities are not the same. Also, the non-pharmacological thing, you said no. Take the vaccine, you don't want to. What do you really want? These are the questions we should ask ourselves.
Yeah, true, ma.
From a doctor's perspective, who's seen someone die, who's seen that in the quest of doctors to save the lives of patients, they die. They get infected and get sick time and time again. I think that it's beyond us. Yeah. We'll take a break. When we come back, we'll continue this conversation. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
All right, thanks for staying with us. So we're still discussing the Edo State's new policy to enforce the vaccination by getting people to have vaccination card before they can go into public spaces or gather in have large gatherings. And we have Dr. Tuyime Bawodu, who is a public health expert, who is going to tell us more about if he feels this would work and how best to implement this policy. Dr. Tuyi, good to have you again on the show. Good morning.
Good morning.
Good morning. Good to have you again on the show. So I wanted to ask you, I hope you've read about this new policy that Edo State wants to roll out by the second week of September. Do you agree with it? Do you believe that this compelling system would be a faster way to get vaccination to increase?
We just have to use some extraordinary measures to ensure that people comply with the vaccination. Why do we have to use this? Because look at all the non-pharmaceutical intervention that we have pushed. Wear face mask, social distances, avoid crowd, wash your hands. People think that those things are just manufactured from somewhere. They are not complying. And of course, the only thing left for us actually to do is to deploy vaccines as much as possible. I had argued in the past and over again that what we need to do is to ramp up vaccination. We need to actually look for the vaccine and give those vaccines. Now it becomes important that if you have vaccines and you're giving that vaccines, then we have to implement ways to ensure that you don't endanger the lives of other people who chose to vaccinate themselves and who chose to run away from crowd. So if we are not vaccinated, we have to actually look for ways. If you are not vaccinated, we have to look for ways to ensure that you don't create more problem for us, because Nigerian public health system cannot respond robustly to increased cases of COVID or any pandemic or epidemic like that. So for me, it's the right step in the right direction. But the key issue now is this. Do we have sufficient vaccine to give to the people? That's question number one. Two, how do we, because you see, showing card may be a challenge, but again, do we have other means to cross-check people attending any function, whether they are properly vaccinated? So it's good.
Do we have enough police officers?
So my question is that a lot of people are saying that government is not doing enough in sensitizing, people about the importance of this vaccine. And some would say, well, government has done enough. It's just that Nigerians do not want to take the lessons. So what is it a problem of? Is it that the government needs to do much more in making sure that people are aware of the benefits, the importance, and the danger of not taking these vaccines?
Yeah, let me say this clearly. Government has not done enough. Let's be fair. Because you see, there are a lot of doubters, there are a lot of hesitancy as far as vaccine is concerned. Government needs to take the team out to the grassroots and educate the people and share examples where vaccines work. Okay, what you have seen is that government has taken the thing far away from the grassroots. The key stakeholders involved, the churches and the religious houses are one of the key people that don't want to take the vaccine. Even the local people, they don't understand what the vaccine is supposed to do. So you cannot tell me that government has done enough. There are still more things to do in terms of campaign and educate people and involving the stakeholders, the traditional institutions to give the vaccines. But if people want to take the vaccines, the procedure to take the vaccines is a bit cumbersome. We have to simplify it and make it accessible to the people as much as possible. The campaign has to go in the local languages for everyone to understand essentially what they need to do and how they need to do it. So there's still huge room for government to do more. Now, but again, what you have is what you have. What you have now is to ensure that even the little campaign, we ensure that it works as much as possible.
All right, Doctor. So don't you think that this call for making it compulsory is going to be infringing of the rights of the citizens? For instance, some people have religious beliefs and different beliefs that may not allow them to take the vaccination. But when you now make it compulsory, we are taking away their own human rights. Don't you think the government should have found other means of making people take the vaccination?
Yes, I agree that you cannot actually, make it compulsory for people to take the vaccine. That's a challenge because they have their right to decide that these are not going to take the vaccine. But if you are not going to take the vaccine, stay at home. So we're not saying you should take the vaccine by all means. But if you're not going to take the vaccine, then stay in your house. Don't join crowd. Don't go to wedding. Don't attend church. Stay in your home. Join your church by Zoom. That's what we're saying. Okay? And we must make that very clear. That saying if you're not taking the vaccine, okay, no problem. But don't use your own decision to endanger other people. So where their right ends, some others will also start. So what is the public good in all these things? And that's for me, that's what we need to push for.
Some countries around the world that produce these vaccines that are even donating it to Africa have a high number of people willing to take it anyway. So what exactly are we doing differently? It's not like Nigerians are committing any crime now. If somebody is convincing you about your fears.
Well, you see, let's agree that this is the largest rollout of vaccinations in the human history, and then we're confronting a disease that is very novel in a way, and then we have to respond to it. Let's look at it. The fear we expressed a year ago about COVID is much more reduced now, okay, because we have confidence that we have something we can use to fight the vaccine. And good enough, just yesterday, the FDA finally approved and agreed that COVID vaccine, the Pfizer vaccine can be used. There's no problem with it, and that is nice enough, and that's good enough for everybody to understand. So we have to actually interrogate the safety of the public, the human, your own rights and decisions, and how to see that what is the best decision in this case. We've seen countries that are actually doing the third shots now. So for us, if we have the first shot, second shot, let us take it and see what is possible after that.
How about frontline workers being vaccinated, that were compulsorily vaccinated initially? Is that not enough to improve herd immunity?
No, we don't have enough doctors now.
I mean, for the case of Edo State.
Again, frontline, listen, for you to get herd immunity, you need to move as much as 60% of the population vaccinated. 60%. You know that the first vaccines that came up was about how many was just about less than 4 million.
Yes.
The people that took these 2 doses were less than 2 million. Okay, so in the whole of Nigeria, how is that going to produce herd immunity? First of all, we have massive vaccine shortage. 2% of the population has just been vaccinated. That is nothing. That is, it's not something we should be proud of be talking about. Even the little vaccine we have to actually use it strategically. People above 20 or above above 18, and then the people that are at risk. You have to use strategically. So if we have that vaccine, we have to use it maximally. We don't want them to have vaccines that will get wasted. We don't want people that refuse to take vaccine to start compromising the health of other people. Because if they have the right to take the vaccine,
Dr. Tsuyi,
they have the right to interact with them. The government has the real opportunity to ensure that, these vaccines are given to the right people, are given in the right quantity, and ensure that we need to protect the public against the spreading of disease. Because look at the doctors, they are on strike. Okay, they're still fighting over that. Cholera outbreak is coming. Government does not have money to respond to the health system. No human resources to respond to the health system. And then someone now want to compromise the fragile health system.
So, but Dr. Tsuyi, we don't have.
He has put us to do, but he doesn't have the right to then encroach on other people. It's just like, for instance, somebody with HIV positive. Now knowing people like I'm HIV positive, and then that's making up to other people. That's not that way without protection. That is wrong. That is wrong. You cannot say that he has the right not to use condom. That is very, very wrong. And of course, it can be prone to prosecution. So let's look at it from that clear angle.
So, Dr. Tsuyi, thanks for your, honestly, I like the example. I mentioned it during the break that it's like HIV, and the best they say you have human rights when your human rights can impact on other person's human rights at the same time. So we can't say it enough. Vaccination is very, very important. And as many of us that have access to a public health center, let's go get vaccinated. There's nothing that would happen to you. You're going to improve the chances of other people who don't have access not to fall ill. We'll still have Dr. Tsuyi with us. We'll take a quick break. When we return, we move into another pandemic ravaging Nigeria. We've recorded over 900 deaths of cholera. So we'll talk more about that when we come back from the break. Stay with us. We'll be right back.